Okay, so my clock says 3:32, so we'll go ahead and get started. Hello and welcome everybody to the session. It's great to be with you here today and to be part of this discussion of COVID-19 stories from and of federal historians. My name is Eric Boyle and I am a historian for the Department of Energy. I've come to know our panelists today through our mutual involvement in the Society for History in the Federal Government, which along with NCPH's Committee for Government Historians sponsors this session. So first, I'd like to give everyone just a brief overview of where the session will be headed this afternoon. We'll begin with introductions from our panelists and then transition to a discussion of how agencies have responded to COVID and the various roles they've played in COVID response. We'll then spend some time looking at how COVID has impacted a specific part of many federal history programs, doing oral histories, before looking at the broader ways in which COVID has made the job of federal historians more challenging in many cases, but also easier in some ways as well. We'll then spend the last part of the session discussing what it has meant for public history professionals to work within the constraints of COVID-19 and some of the specific personal and professional challenges they have that have been faced. So a quick disclaimer for myself and everyone else involved on the panel today. The views, ideas, and opinions you'll hear today in this session are those of the speakers and not the views, ideas, or opinions of the federal government or the specific agencies that our panelists work for. Lastly, if you have any questions throughout the session, we of course welcome those and encourage you to type those into the chat box, and we'll spend some time answering them at the end of the session today. So first, introductions. I'm gonna allow each of our panelists to spend some time explaining their position, their main duties, and their at-work status during COVID-19 this past year, as well as introduce themselves to the rest of the group here. So if we want to start with Jessie, and then we'll move to Richard and then Mattea.
Great, thanks, Eric. And I'm going to share a link to my website because it has a lot of information just in case you're interested in learning more about the National Archives. And so, as Eric said, my name is Jessie Kratz. I am the historian of the National Archives. And before I talk about my role and duties specifically, I want to give you a little background about the National Archives. So the National Archives is an independent federal agency tasked with collecting, preserving, and making available the official records of the US federal government. And these are records that executive agencies, presidents, Congress, and the courts have created or acquired during the course of their daily business. And so to give you an estimate, about 1 to 3% of all records created by the federal government are deemed permanently valuable, which means they will come to the National Archives forever. And these are the kind of records that help us claim our rights and entitlements as citizens. They help us hold our elected officials accountable for their actions. And they, for a historian at least, they help document the history of our nation and help maintain our collective memory as a country. The National Archives, as an agency, we were created in 1934, and our main building in Washington, D.C., which is where I work, was opened in 1935. And it is really the building that most people know us for because we have on display the Declaration of Independence, the Constitution, and the Bill of Rights. At least I guess we normally do. We haven't for the last year because of COVID-19. Since our creation in 1934, our mission has expanded as well as our geographic presence. We are so much more than just that one building with the what we call the Charters of Freedom. In addition to our major research facility in College Park, Maryland, which a lot of you may be familiar with for research, we have field offices all over the country with federal records from agencies and courts that are relevant for each of those regions. And we also have a nationwide network of federal record centers. And these are large warehouses that basically store inactive, temporary federal agency records that belong to the agency still, and we are storing it for them. We also have the National Personnel Records Center in St. Louis, and this has all the personnel records of both former military and civilian workers. So if you are a federal employee, we will have your personnel records in St. Louis. We also maintain the Office of the Federal Register, which publishes the Code of Federal Regulations and many other federal publications. They also run the Electoral College system, which is a nice fact to know. We have the Office of Government Information Services, which is OGIS, and they are, their job really is to improve the Freedom of Information Act, or FOIA, process for both the requester community and for agencies that have a bunch of FOIA requests. We have the National Declassification Center, and their job is to advance declassification and public release of historically valuable records. We also have the Office of Security Oversight, the Information Security Oversight Office. I always say that wrong, ISOO, and they are responsible to the president for policy and oversight of the government-wide security system. And finally, we have the National Historical Publications and Records Commission, and they make grants to state and local archival projects. And in addition to this, we maintain the presidential library system. Libraries all over the country, Hoover through Obama. And we also, this January, just I guess 2 months ago, launched a website for the Trump Presidential Library, which will bring our total presidential libraries up to 15. My position as historian is located within the Office of the Chief of Staff, but my job as historian is to promote and preserve the history of all of the National Archives. So all of these parts I just mentioned, I'm responsible for. I kind of think of my job as having 3 main audiences. And one is my internal audience, my coworkers, my boss, the Archivist of the United States. So I do new hire orientations, I do talks, and when we're in person, I do tours for staff. I answer a ton of reference requests for staff. I write internal institutional histories, and I work on records management for our own agency records, RG64, records of the National Archives, that become permanent records. I also run the agency's oral history program. I kind of think of that as straddling to the two because my second audience is the public who can read these oral histories because I make them available online. But I also do reference requests for the public. I write articles, I participate in videos and podcasts, and I create online exhibits. And I also manage, I have to mention, a blog, Pieces of History, which it's undergoing some maintenance right now. Normally you can subscribe to it, but right now that function is down, but you should check it out. Google Pieces of History, National Archives, and look at our blog. And then my third audience, I guess, is the more academic world. And I serve as a liaison to history organizations. As Eric mentioned, I'm involved with Society of History in the Federal Government, obviously National Council on Public History. I am the co-chair of the Government Historians Committee. I also speak at conferences like this and give lectures for undergraduate and graduate students, really on the history and importance of the National Archives. For my status, I've been full-time telework since March of 2020, and I've only been in our building 2 times, and that was once to pick up a laptop, and once my federal ID expired, I needed to get it updated. And so obviously these closures have affected my work as a federal historian, but it's also impacted the federal history work all over the country and how our agency can work with the historical community. So I really look forward to today's discussion, talking more about the impact of COVID and hearing from the other great historians on this panel.
So Richard, you want to go ahead and go next?
Yeah. Hi, everyone. My name is Richard Hulver. I've been in federal service for just about 6 years now, or just over 6 years. And my first permanent historian position was with Naval History and Heritage Command. So I worked with them for 5 years. And I've been with the National Cemetery Administration for just about my 1-year anniversary. So if you do the math there, I transitioned at the beginning of the pandemic. So like the first month that everything was serious, I actually switched jobs. So I left the Navy and joined NCA, which obviously is a very strange experience to leave someplace you've been working at for 5 years with a bunch of personal relationships and not really being able to say goodbye to anybody, just kind of leaving in the night, and that's it. And then transitioning to a new team that's fully teleworking and not really being able to meet anybody, doing everything virtually, getting your laptop and all of your equipment mailed to you. So it was just a very bizarre transition, which I can talk about maybe a little bit later, but a very weird experience. And with NCA, we're fully teleworking, but they allow us to go into the office once a week. So I typically go into the office about one day a week. And I just want to give you a little bit of background about, I think NCA is kind of one of the more obscure history offices. So I kind of want to talk about, I'll talk about NCA, and I'll also talk about how NCA is situated within the Department of Veterans Affairs. So NCA is one of three administrations in Veterans Affairs. The other administrations are the Veterans Benefits and Veterans Health. All three administrations have history offices. The National Cemetery Administration is the oldest of the three. We've been around since the late 90s. We actually have 3 historians, and the others have 1 historian. And within the past couple of years, the secretariat level has created kind of a central VA history office. So we have a chief historian, a chief archivist, and working on getting a chief curator. And that office kind of oversees kind of coordinates the history efforts of the 3 different administrations. So that's just the situation, give you some situational awareness about the VA's history program. What NCA does, we're one of 3 federal agencies that is responsible for managing national cemeteries in the United States. The other 2 are the Army and the National Park Service. You could also throw in the American Battle Monuments Commission. They're responsible for overseas military cemeteries. So those are the main agencies that are in the deal with cemeteries. Of those, NCA is by far responsible for the most cemeteries. We have 155 national cemeteries and soldier lots. And within those, we have nearly 5 million veterans buried in our sites. And our agency is actually the agency responsible for providing government headstones to eligible veterans. So if you factor that in, we have responsible for memorializing millions and millions of veterans. Our origins are with the Civil War, when President Lincoln was authorized to purchase land for burials of those who died in the conflict. And this evolved over the course of the war and after into a very standardized cemetery system. Think of going from wooden headboards to the marble headstones you see now, to formalized walls and gates and superintendent houses, like making one uniform system. And after the Civil War, there really wasn't a lot of change until the 1930s, when the Veterans Administration was established. At this time period, you had a bunch of Spanish-American War and World War I veterans, and really there was a need for burial grounds more so than there had been since the Civil War. So the Army and the VA did studies to see where we needed cemeteries, and they kind of strategically placed them where a lot of veterans lived and where demand was going to be high. So there was a big construction program during the Depression and the New Deal era to build 7 new cemeteries, tied very closely to like CCC construction and WPA work. At the same time we were expanding, we transferred 13 of our cemeteries were transferred to the National Park Service, the big Civil War battlefield cemeteries. So that's how they have cemeteries. And really the next big shift didn't come until the 70s, when the National Cemeteries Act was passed and the National Cemetery System went from the Army to the VA. And really the only cemeteries the Army maintained after that are Arlington National Cemetery and the Soldiers and Sailors Home in DC. And they also maintained the active cemeteries on their military posts. So other than that, all the cemeteries went to the VA. And then in 1998, the National Cemetery System became the National Cemetery Administration. And we continue to expand, and it's really based on demographics and need, like it was in the 1930s, looking at where we need cemeteries. But that's there's still expansion going on. What my office does is our work is very standard, like to other history offices. We do a lot of research. Our research is really specifically tailored to burial benefits. We do a lot of work determining who's eligible for a marker. There are a lot of unmarked veteran graves still, and people want to get markers placed on those. So figuring out if the person they're trying to get a headstone for is eligible. Also, when markers need to be replaced, making sure that the inscriptions are accurate. I think the most fun part of the job in the research area is telling the stories of our veterans. I mean, we have, like I mentioned, millions of veterans and sites all across the country from every war. So as a historian, that's very exciting, because there's really not a history that we can't tell. There's always a veteran tied to just about anything in one of our cemeteries. We also do administrative work, just keeping up to the changes of our sites. recording major events, which we'll talk a lot about COVID today, leadership changes, doing exit interviews with our leaders. The history office does facility histories, so making sure we have accurate and updated histories for all of our cemeteries, old and new. When we get new cemeteries, kind of laying the groundwork for those histories. We do a collection management's a big part of our portfolio as well. We have, memorials, markers, architecture, 1,400 monuments in our sites. So keeping accountability for all of those. And I'd say the last part is historic preservation and stewardship. I mean, most of our sites are on the National Register of Historic Places, and anytime a change is proposed, that has to go through the proper channels and processes. So we deal with that, we handle that. And I'll talk more about that. One of the big things that happened during COVID is we had 3 controversial German POW World War II headstones that ended up being removed in the midst of COVID, which is kind of an interesting story that I will touch on later. But that is all that I have for my intro. So I'll pass it to Mattea.
Hi, my name is Mattea Sanders, and I am the 316th Wing Historian at Joint Base Andrews. So I am part of what's known as the Air Force History and Museum Program, which is a combined program made up of the National Museum of the U.S. Air Force at Wright-Patterson Air Force Base, the Air Force Historical Research Agency, which is at Maxwell Air Force Base in Montgomery, Alabama, and then the field historians. The field historians are made up of what are called major command historians. The Air Force uses what are called major commands, which is the way of basically organizing the entire Air Force. And they're divided by the types of missions. So we have Air Material Command, which does sort of acquisitions. We have Air Mobility Command, so they're responsible for getting people places. So they're doing a lot of cargo. And then we have further major commands from that. Under those major commands are what are called wing historians, which is what I am. Interestingly, my major command is actually called the Air Force District of Washington, and I am the only historian in my command. So I act as the de facto Air Force District of Washington historian as well. And we exist to be the Air Force assigned to what's called the Joint Task Force National Capital Region, which is a command of cross department branches that help and support the National Capital Region. So they're at Fort McNair, and they have an Army element and they have a Navy element, and then we are all of the Air Force forces for that. So at Joint Base Andrews, the 316th Wing does that. We are also what's called the base unit. So we actually operate the base and make it run every single day. I don't do the presidential mission. That's actually another unit historian at Andrews, but that is what Andrews is most known for. My unit consists of 4 groups. When COVID began, it was actually 5 groups. So I used to have the United States Air Force Band, the United States Air Force Honor Guard, and then the Arlington Chaplaincy, who still do services at Arlington. We actually lost that group as a result of a unit change in June of last year. I also have a security forces group who manage security on base. I have a medical group who runs a hospital known as the Malcolm Grove Medical Clinic on Joint Base Andrews. And so that, of course, and I'll talk about that, was a huge part of COVID. I have an operations group who flies UH-1N Huey helicopters. If you are ever in DC and you see blue helicopters that say United States of America on the side, those are the helicopters that are assigned to the 1st Helicopter Unit. And then I have a mission support group who does the running of the base. So that's everything from firefighters to civil engineers who make sure the lights turn on every day, to logistics people who get people to where they need to be. So that's the full gamut of the mission of my unit. I am located in what's known as a wing staff agency, which is the personal staff of the commander of the unit. And the idea is that the historian should always be attached to the commander's staff, because you need to be there whenever the commander is making a decision, whenever he's having a meeting, you're supposed to be there as the wing historian finding out. And the reason that you're there is the first major part of my job is writing what's called the command history, which is basically an administrative history that's of everything that's happened in the unit in a given year. And so I turn that in, and that actually goes and lives at the Air Force Historical Research Agency, who has an agreement with the National Archives to preserve these documents for the Air Force. And they live at AFRA rather than actually at the National Archives. The command history is a collection of documents that I can take all year. And then I do a lot of writing, narrative writing on everything that's happened. I also conduct oral histories for this command history. Last year alone, I conducted about 35 oral histories, from commanders to offices of responsibility for particular events afterwards, to find out how they experienced it. I also do a lot of consultation. So those histories create an archive that I manage of all of the histories from the unit and from the base, and newspapers and photos. And I use that archive to provide information to my commander, to the base unit. I'll get requests for information from him that's saying, oh, I'm trying to make this decision on this particular issue we're having. And so I will provide a historical context to say, okay, this is what we've done the 5 years prior to help him make that decision. The next thing I do is I do a lot of outreach. So I give briefs. I'm responsible for giving 2 briefs to my wing every month. And that can be from everything from a particular event. We're doing a lot of humanitarian work right now because of the COVID vaccine. And so last week I gave a brief on humanitarian missions that the 316th has taken part of previously. I also, because we're the base unit, I do a lot of base outreach. So I gave a tour for spouses of the base who are coming and they're new to the base and want to find out. I give a welcome to Andrews for general base personnel and units to find out a little bit about the base. I also do heritage displays. So I, rather than doing exhibits in a museum, I actually produce exhibits that go into the workplace. So they will go into the conference room or the commander's office and be a little bit of the history of the unit and the history of the base. I'm also responsible for emblems and heraldry. So I keep a log of all of the emblems that the unit wears. Every single person in the unit wears actually a patch, whether it be their squadron patch or the wing patch. And I'm responsible for keeping these and for processing them if they want a new one. And then the last thing I do is I manage historical property. One of the strangest things that when I first got this job 2 years ago, was somebody came up to me and said, so we need to get the plane that's in front of the building painted. I had never painted a plane in my life or knew the first thing about how to start. So I'm responsible for, I have a helicopter, I have actually an F-105 that I'm responsible for, and I have to do an inventory on and make sure it gets painted and make sure that it's up to date. And so that's a big part of my job. So that's everything that I do. During COVID, I was at home for basically March through the end of June. And I'll talk a little bit later of why it was just until June that I was at home. In June, as a result of the unit really ramping back up as far as their mission, I was not told that I had to go back to the office, but it became very hard to do my job and not be in the office. So I have been basically the majority of the time in the office since June of last year. So I'll turn it back over to Eric to start our questions.
Thank you all. Now that we know a little bit more about each of your positions, I'd like to begin by asking some broad questions about the operations of your agencies this past year. So beginning with Mattea, can you tell us how your agency responded to COVID and what role, if any, your agency played in the federal response to the pandemic?
Yeah. So my unit played a huge role. So the first one was, as I was saying, I have a medical group. And so it was essential in testing on base, in responding. We actually sent out a unit that were part of what famously is known as Operation Warp Speed. We actually sent medical personnel that were part of that effort. And so the medical unit was part and parcel. We actually stood up a daily call that lasted from basically mid-March through the end of May. That would be a daily report of how many people had been tested, how many positives there were, how many people were in isolation. And so we were directly responding to the COVID epidemic on base. One thing that was really fascinating that I heard constantly was that there was no playbook when it came to COVID for the US military. The military is very known for exercising everything. We exercise in the event of something happening. But when it came to COVID, the disease exercise that we have always done was based on there being a disease outside the base that then you could just shut the base down and the disease would not come into the base. That with COVID, that's not possible. The disease was everywhere. And so they were literally making it up sort of day by day as we went through the pandemic and having to figure out how to respond. There were also missions that had to keep going. They just you couldn't stop. You still had to have security forces coming to work. You still needed to have firefighters. Interestingly, the chaplaincy and US Air Force Honor Guard still did missions like throughout COVID. And so I wanted to make sure to document that they were every day out there with their masks on, still doing those ceremonies at Arlington. So there was definitely, I think the military was a huge part of the COVID response.
Richard, can you tell us about how the National Cemetery Administration responded, or how it impacted operations for you?
Yeah, sure. When you think about Veterans Affairs, I mean, you first and foremost think about health, providing healthcare. And while the National Cemetery Administration, obviously, we're the end of life part of the process. I mean, it's not healthcare, but you think about the number of deaths that happened during the pandemic. You know, a large number of those were veterans, and we had a service to provide still to give those veterans a proper burial, and that didn't stop. So, I mean, that was an essential service that was going on throughout. So, throughout the pandemic, we continued to provide veterans a burial. But we had to do so in a different way, particularly in the first several months. I mean, typically there's a graveside service and actually, services within our cemeteries, but that was just too dangerous at the beginning. So we had to go to direct burials, where basically the remains would come to the cemetery and they would be taken right to the grave and buried without a family being present. So, I mean, that was a really big shift, and we offered families the ability to postpone burials if they wanted to, and a lot of people did that. But in certain parts of the country, I mean, this was a huge, we have a cemetery right outside of New York City, Calverton National Cemetery, and I mean, they were just absolutely inundated with burials. I mean, the whole funeral system in New York was overwhelmed, and we went from doing like 12 burials a day to 50 burials a day for 3 months straight, 7 days a week. So, for us, for my office in the history program, the biggest thing was, recording this and making sure that we don't lose a record of this, that we're doing oral histories, that we're collecting artifacts of this change so we can tell the story in a museum exhibit someday in the future. So that was a big part of what NCA did and what the history program did to support that. The other element that with NCA that you can't really talk about COVID without talking about this was Memorial Day, because that's, for the National Cemetery Administration, Memorial Day is pretty much our Super Bowl. That's the moment we're preparing for all year. As soon as the last Memorial Day is over, you're getting ready for the next. And we had all of our plans in place, and then Memorial Day is a few months into the nationwide lockdown, so those plans had to be ripped up and thrown out and adjusting on the fly. So this was the first time in our administration's history that we've done an entirely digital Memorial Day, entirely digital commemoration. So that was a huge shift. Luckily, we have a platform called the Veterans Legacy Memorial that was launched kind of coincidentally around Memorial Day, where basically every veteran buried in our cemetery has their own memorial page with their headstones on there and their basic information. And that opened up a Memorial Day for the public where they could go into these veterans pages and leave tributes. So that was an easy way to shift, but it's still no on-site ceremonies. So a lot of changes. And that's something that we, again, the history program, we were moderating message boards and trying to get Memorial Day content online for the public and trying to record these changes in oral history interviews. So those are two big changes. And also kind of a change in administration came in the midst of everything too, where our undersecretary was, this was his final year, and he had started a bunch of we had expanded with some construction programs. So we opened an unprecedented number of cemeteries in the middle of the pandemic. I think 12 cemetery dedications, which obviously that had to be done very, very differently. So we're opening cemeteries without ceremonies or without large ceremonies, without large public gatherings. So again, the history program, we're kind of helping the public affairs departments answer questions and providing context for what's going on. So and you can imagine with all of these things, the burial restriction, like change burial policies, change Memorial Day programs. I mean, these are all very sensitive things where families want to grieve and remember their family member, and when you're telling them that they have to do that differently, it was kind of both ends of the spectrum. You had people that totally understood, and you had people that didn't understand at all, and it's just kind of having to be very sensitive to the situation and listening to people. It was just kind of a unique situation to be in. So
it's probably not surprising to a lot of people on today that the Air Force and the NCA were impacted by COVID directly and had an impact on their operations. But Jessie, can you tell us what might be some of the less obvious impacts that COVID had on the National Archives?
Sure. Well, last March in 2020, we began the process of closing nearly, I think, all of our facilities because of COVID-19. And we're the National Archives. We have original paper records that people can look at. We obviously do have a lot of electronic records. And so during that time, we've beefed up our online catalog and our social media presence. But people who wanted to come visit the National Archives in College Park, where a lot of our records are stored, just couldn't see the records. So pretty much all of NARA staff has been full-time teleworking since then. Nearly all of access to federal records has been cut off for not only the scholarly community or genealogists, but the only people who are really getting records right now are veterans who are getting emergency requests from the National Personal Record Center because they need them for burials and medical emergencies and homeless veterans. And so we've really almost come to almost a full stop with in-person, but we have tried to move as much online as humanly possible. And part of this, we realized that we needed to sort of step up our game. And so we got CARES money, the CARES Act money, that basically has given laptops to everyone, or getting laptops to everyone in the agency. So we're able to do our jobs as much as humanly possible remotely, because when we first started this, some people didn't have laptops, they didn't have internet. We just kind of figured out that, we have 2,800 employees and not everyone, has internet connection and ability to work from home. But I have to say that our leadership has been fantastic during the pandemic, and they have been really following the science, and they were we're opening and phasing staff back in based upon local conditions. And so I have to really give them credit. They've been giving us monthly meetings to talk about what's happening. And hopefully we're going to be edging out of this soon, and we can start opening our facilities again and people can have access to records. But we have this enormous backlog of requests, not only for FOIA requests and for research requests, but also for personnel records. And so it's going to be really difficult once we get bodies back in the building to actually start, having some semblance of normalcy again, I guess.
Thank you for that. So now that we have a sense of these broader impacts that COVID has had, I'd like to ask a question about specific projects that you may have pursued during the past year. So beginning with Richard, can you tell us what types of projects you pursued or as a result of the federal government having to respond to COVID-19?
So I think one of the things early on when, like I said, I came on board at the very beginning of the pandemic. So I mean, one of the things that I was kind of tasked with focusing on was bringing a publication to completion that kind of been put on pause before the pandemic. So I think it was a way for me to get oriented to the administration and also kind of take advantage of the maximum telework where you can really focus on research and writing. So we really made an effort to get a 75th anniversary World War II pamphlet done that focused on our burial program. So that was one kind of positive outcome of COVID, getting that finished and getting that out to the public. I'd also say one thing that NCA kind of had a perfect storm hit early in the pandemic on top of everything else I'd already talked about. We had three very controversial headstones within our cemetery system that came to light early in the first few months of the pandemic. So we have POWs in our cemetery. So any POW that died during a war in U.S. military custody could, if they weren't claimed, could be buried in a U.S. national cemetery. So we have POWs from pretty much every war, all nationalities, but we have 3 German World War II POWs in our cemeteries that were buried with the World War II Iron Cross on their headstone, which unfortunately features a swastika on it. So we had one private marker with this Iron Cross, and we had 2 government issued markers that after the fact, the Iron Cross has been added to it. And I mean, the history program and NCA has always known about these. We've always interpreted them, but again, they're in historic sites, so they've just been there. But when the VA secretary did his testimony about the VA's COVID response to Congress, and he kind of got waylaid about these Nazi headstones, which it was kind of coincided with all the social unrest going on at the time as well, the Confederate monument controversies. So you can imagine, as being the history program, a lot of that fell on us to provide context to these. So we had to go into overdrive like I said, we already had interpretive materials, but we had to really beef that up. And then the secretary ultimately decided that we were going to remove these headstones, and we had to go through the Section 106 process. So, I mean, that was something like that would be kind of a total nightmare in any circumstance, but add a pandemic on top of that, that certainly made for an interesting situation. So those are two projects that like really stand out to me dealing with during the pandemic.
Jessie, I can imagine that COVID had some impacts on projects for you as well. Can you tell us a little about some of those impacts?
Sure. Well, COVID, I can't say it was fortunate timing, but right about the time that COVID started, I was wrapping up a major institutional history that's for internal effort. It's internal distribution, so I don't share it with the public, but it was a good timing so I could actually finish it up and just do all the editing and get it put to bed. And I don't think I would have had the time if I was doing all the things I do in the office. So that was actually a positive. But before, I would do things like external talks and lectures in person, and it required to have, it required in person, and I only were able to reach the people in the room. I would do like special architectural tours for the building, but again, it was just a really small group. So COVID kind of enabled me to like begin to do these virtual talks with both external and internal audiences. And I started with just a virtual talk about the history of the agency, but then I kind of developed more and more. So now I have one for like the architecture of the building. Also, I like to do a lot of staff outreach, and I always try to give like new hires tours or orientation, just let them know who I am. But I never really had a slot on the new hire list. But now they went virtual, I've been given a slot. So every 2 weeks when we bring new hires on board, I get to talk to them about our agency and our agency's history. And they know that I'm a service for them. And I've never had that opportunity before. So that's actually been something great about COVID. And then another big project that I started during COVID is actually documenting COVID itself for our agency. And so when this is over, I will hopefully have the outline and the resources all together that I can sit back and try to write this history of what happened with regard to the National Archives, over this past year and then moving on. So there's lots of projects going on. I'm used to working virtually, so it hasn't been the biggest change, but it has definitely been an adjustment.
I can imagine. I had a similar experience in my position. Mattea, are there any projects that you pursued as a result of the Air Force response to COVID that you can think of?
Yeah, so one thing that was interesting is that I had been in my job about a year when COVID began, and up to that point, the first 6 months of a job, you're just trying to find out what's what and just trying to get a sense of the agency. And so the 6 months sort of after that, I was starting to work on projects and starting to be relied upon, especially for the consultation part of my job. But when COVID began, there is this sort of sense of not now, it's the history office, we have bigger fish to fry. And so I took it upon myself, especially because one of the big parts of COVID as an agency was just the amount of guidance being put out on a daily basis. There's one piece of guidance called the Force Protection Health Guidance, and they put out numbers, and I think we're on number 30 at this point today. And so each one of those would say okay, we're replacing the previous guidance and then we're adding on this guidance. And so one of the things that I thought about oh, this would be a great idea is I develop a chronology as part of the history. But as I was building my chronology, it was literally, instead of week by week or month by month, it was day by day. And so at the end of each week, I would provide my commander with that week's chronology that I had created, that had both the large guidance that was being put out by the Department of Defense and the Secretary of the Air Force, but then also anything that was made about that time. And that became really, really important, especially to find out dates that we did closures. So it would be that I recently was in a meeting where we were trying to find out what was the day that we closed the golf course on base, and what were the measures at that time that forced us to close the golf course. And so I was able to use that chronology that I had created to supply that, to say it was because of this that's why we closed the golf course. So that was a huge change, and that actually led to me being incorporated as the person in the unit to be in charge of lessons learned for the whole unit. And so I was responsible for collecting all of that and creating a record where previously I hadn't really done that. So that was the major product. For my outreach work, I actually created virtual tours so we have an innovation cell that does it, or the idea is they're doing a lot of digital work. They have 3D scanners and 3D printers and all of this stuff. And so I had them 3D scan the 2 historical buildings that we have on base, and I created 3D tours of those buildings. And I was able to put that on social media. And so previously I might have done a tour of the historic chapel that was built in 1850, but I was able to create that virtual tour, sort of similar to how you would see on a real estate website, doing the same software, and people were able to take the tour using that software.
Yeah, I get a sense that the move to virtual tours in a lot of ways predated COVID, but it's certainly been ramped up at a lot of federal agencies. And just as there's a lot of evidence that virtual tours have become a more widespread phenomenon throughout the federal government, and of increased opportunities for access, I think in a lot of cases. I think there have been some increased opportunities in the areas of oral history as well. And so first, Mattea, can you tell us a little bit about how you have conducted oral histories over the past year, given social distancing requirements?
Yeah, so one thing that might now seem very obvious, but wasn't pre-COVID, is that before COVID, it would have been very, very hard to do an oral history not in person. Not because necessarily you would have not had the technology, like the technology was there in some form. Microsoft Teams, which is the major software that the Department of Defense uses now in COVID, was going to be rolled out later in 2021. And basically what they did is just they rolled it out early because they saw a need for an online piece of software. But it would have been hard to sort of pitch to someone in another far away that if they were in Japan, for instance, for you to do that oral history over Teams. They might have said like, oh, well, you should fly here and you might have the money for that or you might not. But when COVID happened, it was almost instantaneous where you could email someone and say, I'd like to do an oral history. And they would immediately say, okay, yes, yeah, we can do this by Microsoft Teams. And Microsoft Teams had so much built-in recording that you were then able to have both the audio and the video, which would have also been very difficult to set up pre-COVID. So that really enabled me to expand the amount of oral histories I was able to do because I was able to just record them using Microsoft Teams and was able to talk to basically anyone in the world.
And Richard, how about you? Has your experience been similar or different in terms of oral histories?
Yeah, I don't have a whole lot to add to what Mattea said. I mean, I had a very similar experience. I mean, I had done a lot of oral histories with the Navy before joining NCA, and I kind of had that old school mentality that you've got to be in person, you've got to be having direct eye contact, kind of building relationships with people as you're doing these oral histories, gaining that trust. But Microsoft Teams, it made things easy. It didn't take long to sell me on the value of that. I mean, we had people all over the country that we wanted to interview, and we wouldn't have been able to do that without Microsoft Teams. So, I mean, we found that you were able to kind of do the video part up front and, have some like pre-interview chat and then kind of get into the audio and record it on Teams. And we had our backup tape recorder, and it just we had so much more flexibility with scheduling and not having to travel. It worked really well. And I don't see probably, I think it's probably going to change the way we do all of us do oral histories in the future. It's probably going to be a lot harder to justify getting that travel money when you can just fire up Teams. So.
Yeah, it seems there's always some upside and downside to those changes. Jessie, what has the National Archives been up to in terms of oral histories this past year?
Well, I have to echo everything that Rich and Mattea said. We definitely have a lot more participation now because of the ability to, we have facilities all over, and now I can just call somebody, we use actually Google Meets, not Teams, and it's a very similar platform, but I find it easier when you're interviewing people who are not, outside, they've left the government, and I can easily just set up a Google Meet and we do our interview. I have two good things that sort of happened from this. So last year when COVID started, I had, the Archives has this big cross training program, and it allows staff to do cross trainings in various offices. And so I had 2 cross trainees working on oral histories when COVID started. And so it was great. They were great to help me kind of like use them to test the equipment and test transcription software, because we were doing a lot more oral histories than we did before, because we just had, everyone was working from home, people had time, we could interview anyone. So we actually have better processes now for doing oral histories. And in the past, I would, get kind of, because we provide the transcripts available online. That's our record copy, and that's what we should give. And I would have to get like a critical mass and then have them transcribed. And by the time that I had them transcribed, the cross trainers were gone. But now we use this like super cheap AI transcription program that works actually pretty decent. So our new process, because of COVID, is they actually do the interview, they get the transcription almost immediately, and then we have it ready to go, we're ready to post. And so I guess that's one positive thing for oral histories that has come out of COVID.
Yeah, I think process, it sounds like across the board for everyone, has changed, and it's only a matter of seeing whether or not it will remain changed long term. I'm curious about whether each of you may have also conducted specific oral histories because of COVID that you may not have or would not have likely. Sorry, can we start with Jessie on that?
Yeah, so part of this documentation of COVID-19 report that I'm doing is I'm conducting separate COVID-19 interviews with staff. And so we've done about 50 interviews so far, and it's runs the gamut with people who, have been on site, or, people at the NPRC pulling records, high-level staff. We've actually done the Archivists of the United States. And so I'm going to use these interviews to help me with that report. But also my plan is to actually share the transcripts of them internally. We have this thing called the Internal Collaboration Network, and it's sort of like Facebook, but for the agency. And so I'm going to put those up there so staff can see what other staff's experiences have been during the COVID-19 pandemic, which I think is going to be a great resource for folks. And also, I had those cross trainers last year. The program started again this year, and I have a cross trainee right now working on those oral histories. And so, by the time we're done with this, we could do, maybe 300 interviews with staff, and we only have 2,800 employees. That's a pretty big part of the archives we'll be talking to.
Yeah, that sounds like a pretty substantial, significant impact. Mattea, how about you? What's been your experience?
Yeah, so I sort of similar. And one thing that I find really interesting about COVID is that I do think there's been a big concentration of agencies wanting specific COVID studies. Like they want, whether it's like in a regular administrative history or in a command history that they routinely do, is that they really want to see my history, I think, is like 400 pages long, and over 200 of that is about COVID. And then the rest of it is like regular stuff, but because of COVID. So I definitely used oral history to try to get the human experience, like beyond just the data of the case rate or the amount of people tested. So I was really interested in interviewing people who were really experiencing it, especially because comparing it to the stories coming out in April and May of frontline workers, that we had our own frontline workers. So we had a tiger tent, it was called, like a COVID tent in front of our medical clinic, where they would triage people coming in and decide, like, were they there just to get asymptomatic testing? Were they there to just go to the emergency room? And so I actually did some on the ground interviews with them. And that was interesting because it was a very different type of oral history. And actually, before COVID began last year, I had the idea that I wanted to do short oral histories where I know that I'm not going to be able to get someone to come in my office and sit for even 15, 30 minutes. But it was something that I could go to their workplace with COVID restrictions in place, and even just to have a 5-minute like record, here are 3 questions. And then if I do enough of those to give that description. So, and one thing that makes that easier is that in the Air Force, we don't require a release form if you're active duty, if those are just being used for the annual command history. So that makes it a little bit easier to be able to do that. So I would go out to the Tiger tent and I would do these like short interviews with people working. I also did interviews with some of our pharmacy workers, because one part of the medical, even though a lot of the clinical work either was like put on pause or didn't happen during COVID, the pharmacy still had to go. They still needed to get prescriptions out. And so they actually moved the pharmacy out of the building into a parking lot next to it. And there was somebody who came up with that idea. So I went out and I was interviewing both these pharmacy workers, but then I was also able to interview some of the people who were benefiting from that and get their experience, if they were base personnel or if they just lived on base, of how they were experiencing COVID, so that I was able to get both of those perspectives.
Sounds like some great opportunities there as well, in terms of documenting the history as it unfolds, which I think a lot of people don't realize federal historians do, or are called upon to do on a regular basis. How about you, Richard? Have you conducted specific oral histories because of COVID?
Yeah, definitely. So, I mean, early on, as I mentioned, as the death numbers increased, I mean, that was really having an impact on our operation. So, the NCAA history program made a decision early on that we needed to go out in the field and interview employees about their experiences. And that coincided nicely with, I mentioned in the beginning, we have the new VA history central office. So the central office kind of led a VA-wide history COVID initiative to collect COVID-19 stories and artifacts. So the NCPA program was able to work into that. But I mean, our goal was kind of twofold. We wanted to do like lessons learned, just was in case like operations have to change again in the future, what has been learned here. So kind of internally, and we also wanted to capture people's stories so historians could write about this in the future. And if there's a COVID-19 exhibit in a VA museum, that the NCA story could be told, that those oral histories could be used. So for us, the key was getting all perspectives. So I mean, we made an effort to interview, the leadership in DC, and to get every region within the United States covered. So we really wanted to make sure we had the epicenters, but we also wanted to make sure we got everything in between, our small, more rural sites. And we, like I said, we're trying to get leadership in DC, cemetery superintendents, but we even made an effort to get the individuals that are operating the backhoes and opening the graves, and the HR representatives that are doing the scheduling. So I'm really proud about the wide range of perspectives we were able to get. And as I mentioned before, within all of that, for us, capturing Memorial Day and change of administrations, it all kind of tied together.
I had intended to ask a follow-up question as well on how the content of these oral histories has also changed. But looking at the clock here, we only have about a half an hour left in the session. So I think I'll move on to talking about how in some ways, it sounds like doing oral histories has become easier in the past year. So if we could, I'd like to switch gears to talk about aspects of your job that may have been harder as a result of COVID. Mattea, can we start with you?
Yes. So one thing that was interesting is that when I first took my job, there had been like a significant gap between the previous historian and myself, and that person had a very different idea of what the office looked like. And so I had to really convince people, like, I need to be in the room. I need to be like in these meetings. I need to receive emails. And that was definitely a uphill battle. And so by the time when COVID happened, like I had kind of gotten there with like 85–95% of personnel in my unit. And when COVID happened, it was like that all just went away, because people were having, especially because in the DoD, we had not figured out the technology piece. And that took like a good month and a half to figure out that technology piece. And so these conversations are happening by text, and they're happening potentially by Slack, or they're happening by just emails. And so I had to sort of re-engage and say, I still deserve to be in the room, even if the room itself doesn't exist and it's just a virtual capacity. And that got easier with Microsoft Teams, but it definitely was something that I had to sort of figure out and had to sort of reteach people conversations that I had already had.
Jessie, how about you? What challenges or difficulties have you faced in doing your job this past year?
Well, I mean, obviously, since we have original records, we haven't actually had access to those records. And so a lot of my job would be to consult the original record. I had to kind of change the topics I'd explore, like say in blogs. I manage a blog. There's certain topics I would like to talk about, but if we don't have access to the records or images about the records, we weren't able to even explore those topics. So I guess it really limited to what I could write about over the course of the past year. And it's also harder for me to answer research requests. So I couldn't consult the original records, and I had to rely on my other research skills to kind of look in other published sources to say, hey, we don't have access to these records, but I found something in the serial set that you might be able to use, or, I found this newspaper article, and that's something that, I never had to do before. And also I've also gotten actually what's harder, but kind of a consequence of it. I mentioned that cross-training program. And so I got 4 cross-training, I have 4 cross trainees right now, and that's a lot of people for me to sort of manage, which is great because they're doing a ton of great work, but they're doing a ton of great work. And so it's a positive and a negative because I'm constantly reviewing their awesome work, but I've never would have had that problem before because we wouldn't have had this expanded cross-training program to get people who normally work with original records able to do other things. And finally, I guess what's been kind of harder or maybe a disappointment is I had a pretty vibrant internship program, and I would have interns the fall, the spring, and the summer, and we've had to completely cancel that. And so I haven't been able to really get, the support from interns, and haven't really been able to give any interns the opportunities to learn about the National Archives. Hopefully we can start doing some sort of virtual internship moving forward, but we'll see.
And Richard, how about you? Have you had any similar or different experiences in terms of challenges?
Yeah, I mean, one of the things, ideally, as a new employee, as a new historian with NCA, I would get out and kind of visit our sites and experience them, and that's been difficult. I haven't been able to travel, so in the last year I've only been able to visit basically Arlington National Cemetery, which is right down the road. So that's been very limiting. But I would say one of the hardest things is just kind of what Jessie alluded to, is just researching. I mean, so much of what we do is verifying service for headstone eligibility or making sure things are accurate on the headstones. And, we use newspapers.com, pull through Ancestry. Thankfully, a lot of materials digitized on there. And I mean, you can often get to like the 95% solution there, but as a historian, there's usually that one document that's in NARA that if you just get that, you can confidently be at 100%. We just haven't really been able to do that. So that's been difficult, just, having to come up with a 95% solution and not being able to get that one document that is in a pension file that you just can't get to. I'm sure we've all.
I think we're all probably experience a growing mountain of back work that we're going to have to do, requests that we're going to have to follow up on, and FOIAs that we can't answer, and research requests that we can't answer, et cetera. Now that we've had a chance to learn about some of these challenges, I'm also interested in hearing about ways in which your job may have been easier this past year as well. So starting with you, Jessie, can we hear something about the aspects of your job that may have been easier?
Yeah, well, obviously we already mentioned all the oral history that's been easier. And I also worked from home 2 days a week previous to COVID. So I had already maintained a pretty extensive digital file system. So that was sort of a smooth transition. But I found that, and also to say, I've been able to catch up on a lot of backlog projects during the shutdown, or I guess the quarantine or whatever COVID pandemic. And so that's always been really good. But also what I find is easier, I guess, is working with my colleagues. We've had so much more collaboration across the agency than ever before. I've been on calls with people from the Truman Library or the National Archives in Seattle or, in Atlanta. And so we've really kind of pitched in and decided that, we were this one agency and we were going to work together. And so I feel like I've made so many more contacts during COVID in the agency. So when I have a question or a research request that I'm struggling with, I now have even more contacts than before for people to call up and say, hey, I have a researcher looking for this. Can you help? Oh yeah, I can help. So that is something that I think building my colleagues in the agency and becoming closer with them has been definitely something that's happened during COVID.
And how about you, Mattea? How have things been easier in some ways?
Yeah, I think we sort of touched on this with talking about in reference to oral history, but the other thing that Microsoft Teams and just having electronic sources of having to communicate was that created a record. We just went through, so my unit supports the presidential inauguration in pretty big depth. And it was amazing because everything was done electronically. There wasn't a single meeting that was done in person. And there was always, they actually recorded the meetings. And so if later as I've been writing and I have questions, I can literally go to the recording of that meeting and go back and listen to it. And that would have been unheard of before COVID. And so in some ways, things are like my record collection from the last year was 3,000 documents because there were just so much created electronically from that process.
Richard, are there ways in which your job has been easier under COVID restrictions?
Yeah, I mean, there have been a lot of aspects that are easier, but I think they all come with the opposite too. They're easier things, but there are also some negatives with all those easy things. And like with an example with writing, I think there is more time if you really need to write something, you can, when you're teleworking, it's easier to kind of shut everything down and focus and do that writing. I mean, it used to be you take your telework day when you want to write. I mean, now that's kind of every day. So, I mean, there is that, you have that, but then you also miss the interaction with your colleagues or bouncing ideas off people. With oral history, like we talked about, it's much easier to do oral histories, but in our situation, it sounds like Jessie's office kind of has a good process a very easy process for processing the oral histories. But with us, I found that kind of doing more oral histories comes with an overwhelming amount of processing for us. So that's kind of a nightmare in itself. So, I mean, I think everything has its pros and cons.
Yeah, overall, it sounds like the message from our panelists is that the past year has certainly been challenging in a number of ways, and there have been opportunities, but oftentimes there's a mix. There's both going on simultaneously. So one of the important opportunities I think that the pandemic has provided us with a lot is the chance to be reflective on the nature of the work that we do as federal historians and as public history professionals. So I think it would be great to hear from each of you about what it has meant for you to be a public history professional, to work within the constraints of COVID-19. So Mattea, can we start with you on this?
Yeah, so one thing that was really interesting is there was a call that happened I think it was March 23rd of last year. And it was with my commander and then all of the squadron commanders of the unit. And I was asked to be in that meeting. And during that, he was saying, he's like, this is a very historic event. This has not happened before. And so key to this event is going to be the preservation of all of the documents. And he said, like, everything needs to go to Mattea. And that would have been unheard of 6 months before. And so I think one thing that COVID did was that, you know, every day the word historic was being used, that this is historic of whatever the development was, whatever the response to that development was. And so for me, I felt even more the need to be there. And that my job was even more important. And that was something that definitely meant a lot to me, for sure.
Richard, how about you? What has it meant for you to be a public history professional in working within the constraints of COVID?
Well, I mean, one thing I think it kind of forces you out of your comfort zone in many ways. I mean, you can't engage with the public in the same way you have before right now, because we don't have the opportunities to be out, and we can do digital conferences like this, which is great, but this has kind of been an ongoing process getting these perfected. But you know, you've got to find doing things that you're not used to doing. I mean, I'm getting very, very good at writing concise blogs and social media posting, and, you know, things I'd done before, but hadn't done to this extent before. And like, we produced a pretty large video, which I've never really done before. So just getting the opportunity to do more things, I think, has been one element of being a public historian during this. And I'd also say, like, working in the agency, working within VA, I found that there's sort of a level of pressure that, and this might just be me, but most of our organization are essential workers, and telework's not an option. So I feel like when requests for information come in or when emails come in asking us to do stuff, it's not that we wouldn't answer them in a timely way before, but I feel like there's an added pressure since, I'm teleworking and you're not. Like, I need to get you an answer as quickly as I can. So I just feel like there's been sort of an added pressure of being a federal historian to really get things turned around quickly. I think that's probably an expectation that we turn around things quicker.
And Jessie, how about you? How has COVID impacted you as a public history professional?
Well, I think just now with a lot of people being home, I think our public just has expanded so much more. We have more subscribers to our blogs. We have more subscribers to our social media. We have more opportunity to reach the public now than ever before. And so now, before, maybe only part of my job would be trying to reach out to the public, but now I'm spending so much more of my job trying to, write more blog posts, connect more on social media. Just because now's the opportunity. People have less to do now. They're not going places. And so I kind of think that we kind of want to seize on this moment now and get people interested. And then, when they go back to their regular lives, whatever that will be, they will hopefully still, follow our blogs and follow us on social media, and then realize, come to our virtual programs, use our teaching lesson plans online. So I'm kind of hoping this is where we're able to hook people, let people know who we are, and then keep them after the pandemic ends, and they know we're here and they know we're a good resource. So that's what I hope.
Thank you all for those thoughtful comments. I'd like to leave some time here for questions, but before we get to those questions, I'd also like to give each of our panelists an opportunity to talk about some of the professional or personal challenges they've faced during COVID. I know a lot of us have been impacted in complex ways, and these impacts will have to be reckoned with in the wake of the pandemic as well. Starting with you, Richard, can you tell us about some of the professional or personal challenges you've faced?
Yeah, I mean, I think one of the biggest things is that it's it's hard to separate work and life at this point. I mean, my office is my dining room table, so it's I'm eating my dinner where I work all day. So it's kind of hard to that's been a difficult that's been the most difficult thing for me, I think, is just not having that. I'm in a tiny house in the DC area, and there's not a lot of room. So the work and life are kind of one. I mean, that's been one thing, and just the personal interactions. And I just I don't feel like there have been many networking opportunities or ability to talk to counterparts in other offices. It's been pretty constraining. So, I mean, that's been difficult.
Mattea, what comes to mind when you think about personal or professional challenges that you've faced this past year?
Yeah, I mean, I think the hardest challenge is kind of creating a work-life balance, especially because my work was such a part of the COVID response. And I always compared myself to the people who were having to work from my unit, having to work 12, 14, 18 hours a day. And so I was like, well, if they're having to work that long, and then I need to work that long to document what they're doing to make sure that everything that they're doing is preserved. And it's the afternoon can just bleed into the evening, and you can end up working 10, 12-hour days because you don't have that balance. Even though I was going actually to the office for the majority of the year, it's still there just was no balance, and it still really isn't.
Jessie, how about you? Can you relate? I'm sure you probably can, in terms of personal or professional challenges faced during COVID.
For sure. I have to echo everything that Rich and Mattea said, especially the sense that you always feel like you're at work, and sort of the guilt you have for taking time off, because I'm not going anywhere, but I have leave. So I take the day off, and then I'm like looking at my work phone because I'm like, what am I missing? And so that's definitely been a challenge. We have no expectation to be working on our time off, but it's just this kind of like, I feel like we should be, this is a, exceptional time. I want to know what's happening. So I guess that's what I guess both Mattea and Rich said. It's like, you're always at work. You kind of never want to, well, I work at my house. I live at my house. And so, yeah, it's the same here. And it's going to be like this for a while still, I think.
Agreed. I have a couple other questions in my back pocket here, but I want to leave time for questions from the rest of the group as well. I see a couple questions popped up already, but if you have any questions now and want to add them to the chat, we'll make our way through those. I think maybe we'll start with the question that's a follow-up to the discussion on oral history that we were having. And that question is, how are you all planning to use these oral histories besides writing reports?
I can sort of talk to that a little bit. One thing that's interesting that I didn't get to talk about, we had to skip the question, but is that last year I worked on a project where I interviewed female helicopter pilots, and I interviewed about 15 different women. And one of the things that came up throughout those interviews was that COVID had actually helped them to start having conversations at work about the need for childcare and the need for some of the shift work decisions that their units were making about when they needed to come to work needed to revolve around when they could get childcare. And they said they would never have been able to have those conversations before COVID. And so I actually used those oral histories to have a conversation with brought all of the women that I interviewed together. And they actually used the conversations that they had with me and were able to have with each other. And so that was a real use of the oral history that I think would not have happened before COVID. I don't think I would have thought to use oral history that way, but they needed to have those connections while we did that virtually to be able to have that.
And one thing with us, I can see, I found that a lot of the oral histories we've done related to COVID have been a lot more, there's been a lot more emotion in them than oral histories I've done in the past. I mean, I could really see these snippets of these being really valuable in future museum exhibits. Particularly like our cemeteries that were really, really hard hit. I mean, I think in some ways our oral history is almost, I at times felt more like a therapist than a historian. I mean, I think people are kind of yearning for social interaction, and these were kind of cathartic, and people were just kind of really opened up in ways that I haven't really seen before in oral history. So I can really see that being valuable to tell the story of COVID in the future, having these playing, snippets of them playing alongside artifacts.
Yeah, I have to agree with Rich. I think that the amount of emotion in these oral histories is very surprising, but I also think that they show a nice snapshot of when they were taken, because we've done them since March of last year. And there are these like hopes in some of them. You look back at one maybe in June and you think we're out of it, and then it goes away, and then you see somebody in September. And it's very interesting just to look back to see, how this pandemic has evolved. And I'm not going to write somebody's personal, information in a government history, but just from my own personal sense, it's interesting to look back and see how this pandemic has made people's emotions like up and down and up and down, and they feel really, happy to talk about it, have somebody to talk to.
So the next question is about impacts on your job. And the question is, what long-term changes or impacts do you foresee in how you perform your job as a result of COVID?
I can take this one, I guess. I think that we're going to really move to doing making more things available digitally and being able to work offsite. And I think that I will not necessarily be in a building 5 days a week ever again. I may be in the building 1 day a week. We're really making steps to make sure this never happens again, where we're in a position where we're going to close all of our facilities and people aren't going to have access to records. And so I think what's going to happen after this is we're going to just start digitizing and making records available. And I personally am going to do that myself and make sure that I have the resources that I need accessible to me, so I can be working from, you know, my house in Washington, DC, or Hawaii, or anywhere I want, or in the building if needed. And so I think we're going to have to adapt, and that's pretty much a long-term consequence of what's happening.
Yeah, I would agree. I mean, I think in the past, I always feel like there's been a bit of a sort of some doubt about telework, but I think this is proven without a doubt that people effectively can telework. And I completely agree with Jessie. I can't see a future where it's 5 days a week in the office. I feel like you're going to be able to telework and work remotely. And we talked a lot about the oral histories. I think that this is doing online virtual oral histories is going to be probably the way of the future for many instances.
Yeah, I think definitely on the I had never teleworked, and definitely in DoD telework was very, very foreign and not something a lot of people did pre-COVID. And so that was a big change. And I still telework like 2 days a week, not having anything to do with COVID, just because I want that time. I need that time. One thing, a big change that I do think is interesting is that the expectations of things that I will do are now higher. And I don't know how that will ever scale back, because so many briefs and different things are virtual. Then my calendar stacks up, because it's like, well, you don't have to drive from this place to this place to this place. Like, you can sit at a desk and do 4 briefs for all of these different things in one morning. And I think that we need to be careful of that, because that still is time, and that still is requiring a lot of work. And so I think that's something that I'm concerned about. And I don't know how we tell that story of the amount of time it still takes to do something that you couldn't have done pre-COVID.
So another question is about impacts that changing administrations may have had on your work. How has changing administrations altered your work during this period of the pandemic?
Okay, I'll take this one. Well, one instance is, I guess, I'm on another panel, because one of the things I like to do about our history, about our agency history, is look back and tell stories that haven't been told before, and make it more diverse, and talk about diversity. And it's one thing that under the last administration, we weren't actually able to do. We had an executive order that said we really can't have diversity training. And so we were supposed to do a panel at a conference talking about diversity and the history of diversity and the agency. And so we had to just cancel that, and we couldn't do it anymore. And then the new administration came in, and it was the opposite, and it got, revoked. And then once again, we're able to and encouraged to talk about diversity. So all of a sudden our panel's back on, and we're able to do the panel and talk about it. And it's something that just, we weren't able to do before. And that's just like one instance of how, next month we're doing a great panel, hopefully talking about the issue that we weren't able to talk about previous administration.
For NCA, I would say that just information is flowing a little more freely now. I mean, you could get the information before, but specifically with COVID, I mean, COVID report that like COVID's impact on VA was recorded, and you can get them. You just had to go through a step of requesting to be on a mailing list to get them, but now they're just automatically generated every day. So I feel like it's easier to get a sense of how COVID is impacting VA as a whole as an employee now than it was before. But like I said, you could get them, you had to request to get them. Now you don't.
Thank you for that. We have another question about the impact of COVID in terms of dealing with classified documents specifically. Have any of you had any experience in that area?
Yeah, I'll take that. So I definitely, I wasn't able to access the vault from basically like mid-April to the end of May when I went back to work. And so that definitely created a personal challenge because then that stuff just stacked up. I have a hard time accessing it anyways because of just the availability that we have in my building. But definitely it was something that just had to wait. And I know that other historians, especially like the State Department, they ended up going back, similar to me, ended up going back to work a lot sooner because they needed to have that access to classified information that there's just no way to do it from home.
And I think there's going to be a long-term impact of not just like, Mattea having access to classified document, but just people having access or documents being unclassified or declassified, or people being able to get their FOIA requests done because there's these huge backlogs and there's not a lot of people in person. So there will be, when things go back, to being open, a huge backlog in getting things, declassified and getting FOIA requests and things like that. And that's just the nature of just not having bodies in the SCIFs to look at the docs.
Okay, so we have just a few minutes left here. So I have one final question for the group, unless something else comes from the participants on the Zoom. Are there any lessons learned or big takeaways that you can think of that we haven't covered in the session today? I think, talking about reflecting earlier, we probably hit it at some of those big ones, but is there anything in terms of lessons learned or big takeaways that we haven't covered that you would like to mention before we wrap things up?
I would just say I'm kind of amazed at just how resilient, all these, my office and every office has been. I mean, we've kind of been learning this on the fly, and I feel like it's all gone. It's been difficult, but I feel like in many ways it's gone seamlessly, and I just think that's impressive. I mean, this time last year, I would have never imagined that this is the world we're living in, and but we've done it, and our jobs have, the world's gone on, and we've done our jobs well. So that's just it's kind of amazing to me.
I think I would say to start, thinking about your office in situations like this, start planning, actually, like thinking about almost contingency planning for your office of what that would look like. And start, I think one thing I wish I had done is that I ended up using a lot of my network with other historians to find out what are they doing, or if I needed something, or explaining what I could do if I didn't have access to this information. So I think setting up those networks early and really thinking about what it might look like were both two really, really important things.
And I guess one of the things that I learned that I have to manage my expectations. Like right before this conference, or right before the pandemic hit, we had just spent the last 6 months planning the Society for History and Federal Government's annual meeting. And it was 2 days. We had to cancel it with 2 days left, and all the time and money we spent. We had programs printed, we had the panels together, and I was so devastated from all that that work. And I realize now that that's just, it seems really minor now, but now I just had to temper my expectations that if things get canceled and you've done a ton of work and it goes, to waste, that I don't get all bent out of shape about it. And things happen, and I'm still, grateful to have a job and have friends and to be able to, be here today. So I guess that what I would say is big lesson learned. It's okay. Our conference got canceled. It's okay. I did work, and it was for nothing.
Thank you, everybody. Again, thank you, panelists, for sharing all of your experiences, and thank you for those of you who were able to join us today. I really appreciate it. It's been great. Thank you. Bye-bye.